Yes, villagers, we got 4 numbers that you need to know in order for you to have better health and maintain it. If you want to find out what those 4 things are, you are in the right place. If you're new to this channel, welcome to our village. If you're a returning villager, welcome as well. So, let's get into it. Welcome to Garden of the Mind, where we reduce stress, improve our health and fitness, and improve our financial IQ every episode. Everybody is talking about this vaccine, but in the conversation should be routine health and maintenance. See, your health is a foundational blessing in which all other blessings can flow. So if you want to spend more time with your children, take care of your health. If you want to make more money, take care of your health. We're going to talk about 4 numbers that you need to know in order to preserve your health that much more. Number 1, your weight. Now there's a whole lot of people that don't want to know exactly how much they weigh, but knowing your weight is very important because for your frame, you may be putting excess strain on things like your knees, maybe even your own internal organs as you go through life on a general basis. If you've ever seen some of those shows where they show a person who's lost weight and then have those weights put back on them as they walk upstairs and they didn't realize they were carrying so much excess weight on their bodies, well, those are things that your body carries on a daily basis. If we want to decrease the amount of stress there is on our joints, on our internal organs, we should possibly consider having as little weight as possible so that we can live longer. Number 2, your age. Now there's a whole lot of people that I know who know exactly how old they are. Well, we're not talking about necessarily your age, but we're contextualizing that against health risks that you might have in your family. So go through your family, find out exactly who has passed away, what they may have passed away from, and then go to get screenings to prevent those very things from happening. Sometimes those things alone can save your life. You might be approaching the age for breast cancer if breast cancer runs inside your family. So use your age, figure out exactly what screenings you may need to get, and go for those things as soon as possible. Number 3, blood pressure. Blood pressure is a very important indicator because it speaks about the flow of blood in your body. It can be an early warning sign that heart disease might be coming down the pike. So there might be some things that you might have to do in order to lower your blood pressure, whether that be stress, or whether it be lowering your sodium intake, whatever it is that you can do, find out exactly what your numbers are so that you know whether there are some precautions that you can take so that you can live longer. I'm not a doctor, so please consult with your doctor to find out exactly how accurate this information is and how it relates to you. Healthy blood pressure is 120/80. The systolic number lets us know exactly what the force is of the blood going through your veins. The diastolic number, which is the one on the bottom, lets us know after the heart has pumped, there is a second before it pumps again. What that at-rest number is the diastolic number. Find out what your blood pressure is and find out exactly what you need to do in order to improve it if it's not where it needs to be. Number 4, your cholesterol. Your cholesterol is important because it can give indications of whether you are going to have a heart attack or possibly a stroke. Now with cholesterol, there are 2 types of cholesterol. There is the HDL cholesterol and the LDL cholesterol. The HDL cholesterol is the good kind. The LDL cholesterol is the not so good kind. The LDL lets us know how much plaque there is around the blood vessels. If this plaque accumulates around the arteries, it can lead to a heart attack, or if there's a blockage anywhere else in the body, it could lead to a stroke. Now, cholesterol is one of those things that you cannot look at a person and see whether they have good cholesterol or not good cholesterol. They can look as fit as a fiddle and be on the cover of some of your favorite fitness magazines, but that doesn't give any indication on what they are like on the inside. So we need to find out exactly what's going on the inside. The only way to find that out is by going to the doctor and getting a test. Once you get a test, you know exactly what you're working with. You know if there may be some risk factors that you might be able to neutralize in terms of your eating, or it might just be a situation where there's a genetic link. One way or the other, you would know exactly what it is that we are dealing with once you go to the doctor. When was the last time you had a medical physical? When was the last time you had blood work? What was the results of that blood work? Have you had a prostate exam at this point? Have you had a screening for breast cancer? All of these things we need to find out. But the only way that we have some indication of a baseline is if we go to the doctor every year so that we know exactly what's going on in most of the body. Hopefully, we may be able to catch some things earlier than later. If you like this video, please give it a thumbs up. If you like this channel, please subscribe. If you want to know when I post, which is Wednesday, please click on that notification bell and you get a ding on your phone and you know a new video is waiting for you. And remember, thoughts are actions, words have power, and actions have consequences. I'll see you next Wednesday. See you then.